Good evening. I'm Dr. R. K. Dua. I'm a founder of Fun, Learn, and Earn system for the dentist. So, in the last video, we have discussed the history taking. So, the finding of history we have to confirm by doing the examination. So, what are the various components of the examination? The various components of the examination are: first is the inspection, in which we only see the problem of the patient. Suppose patient is having some lesion in the body, maybe having some swelling in the body. So we just have to look over that and we observe the findings by doing only the inspection. You can say by seeing with our eyes. So second part is the palpation. That means we have to confirm the findings of the inspection by touching the patient, or you can say by examining the swelling or the wound or whatever it may be by touching the patient. Next is the auscultation. Auscultation means we have to hear the abnormal sounds with the help of the stethoscope. Then comes the percussion. That means we have to percuss the part of the body, and by percussion we can hear the change in the resonance sound that will originate from that part. So that means if the hollow structure is there, the sound will be resonant. If the fluid is present, the sound will be dull. So what are the various components of the inspection of a swelling? So most common thing is swelling or ulcer or a wound. So let's start with, we can say that the patient is having a swelling in some part of the body and we have to do the inspection. So what are the various things that we have to inspect? First is the site where exactly it is located with relation to the anatomical landmarks. Then the approximate size that we can judge by looking at the swelling. Then what is the shape? What is the surface? Surface may be lobulated, smooth, scar mark, borders of the swelling. If there is any discharge from the swelling, any scar mark over the swelling, any abnormal pulsation visible over the swelling, or any kind of abnormal, you can say, the vascularity which is visible on the surface of the swelling. Then here comes the palpation. Palpation means now we have to touch the swelling, we have to hold the swelling in our hand, and we have to find out various things by touching the swelling. So, in case of palpation, the first step should always be observing the temperature of the swelling from the back of the hand, like this. We have to check like this. So that means we have to observe the temperature of the swelling, whether it is the normal temperature or whether it is the temperature is increased. So before putting the hand over the swelling, we have to put our hand on the opposite side so that we can have the impression of the temperature of the body. Then we can compare the temperature from the normal part of the body with the swelling. So main aim is to confirm the findings of the inspection. Second is the site, size, shape and surface. So in this case we have to exactly measure the size of the swelling, then exact location of the swelling by measuring the distance from the various anatomical landmarks. Then is the shape of the swelling. We have to touch the swelling and feel the margins of the swelling. So whatever is visible to us as a smooth margins, when we palpate the margins, we will find that the margins are not smooth. Then the surface of the swelling, we have to, you can say, the touch over the surface whether the surface is smooth, lobulated, irregular. Then comes the borders, we have to palpate the borders. Then comes the tenderness, whether it is present or not. Tenderness means when we touch the swelling, the patient feels pain. Pain on touching is known as tenderness. Then, when we place the hand over the swelling, we have to check whether there is any abnormal pulsation in the swelling is present or not. That abnormal pulsation could be from the inside of the swelling, or it could be a transmitted pulsation when the swelling is resting on some bigger vessel. So that bigger vessel can give rise to pulsatile effect over the swelling. Then comes your skin over the swelling, whether that skin is fixed to the surface of the swelling or not. We can simply pinch this, you can see when I pinch this, that means the skin is not fixed to the underlying muscles and the bone. Then comes the fixity of the swelling over the underlying structures. So underlying structure means if the swelling is present here, suppose this is a swelling, if I move it here and there in vertical direction as well as in the horizontal direction, whether the swelling is movable or not. If the swelling is non-malignant, if it is of not of longer duration, most of the times the swellings are movable more in the horizontal direction and less in the vertical direction, but these are movable in both the directions. If the swelling is fixed to the deeper structures, that means the chances of the swelling to be malignant are high as compared to the swelling which are movable. So any discharge from the swelling that is coming on pressing the swelling. Suppose you are having, you can say, sebaceous cyst, punctum is there, that is a blocked opening. When you press the sebaceous cyst, you will find that the pultaceous, foul smelling, paste like structure will come out of that sebaceous cyst. So, what is that sebaceous cyst? Sebaceous cyst is actually the blockage of sebaceous gland by the dried up secretions. So the fluid or the sebum keep on